Be presenting an update, the data on the SIC molecule in our CLL cohort, which was presented at ASH and will be updated at ASCO as an oral session. I'm presenting on behalf of the investigators. SIC inhibition is very important in CLL and we believe may have some clinical utility. SIC is a potential driver of B-cell malignancies. It's critical. It's critical for BCR signaling via SIC is required for B-cell survival. Inhibition of BCR signaling is associated with clinical benefit in CLL. There was a Rigel compound R406 which had SIC activity and had positive data in CLL. Thank you. And this is the ambit KD analysis of 9973, which shows it's highly selective for SIC, and then in comparison, the Rigel compound, which had many other activities. So this is really sort of a proof of principle of SIC inhibition in CLL. And also SIC is important in non-BCR mediated survival responses and cellular responses. For example, in integrin, SIC plays a critical role in cellular responses. And this is actually seen across many other areas of important biology, including bone reabsorption and osteoclast differentiation, cytokine release, cellular proliferation, and differentiation. And 9973 in preclinical data in healthy volunteers has been shown to have what we think is biologically important levels. The current dose exposure plateaus at about 600 milligrams twice a day, with Cmaxes of 25 to 3,000, and at lower doses, GS9973 are better tolerated in fasted state. The reason why we took the dose of 800 milligrams into the clinical trials with this compound is that there was a significant degree of biological variability. About 10 to 15% of the subjects did not absorb the drug as well, and therefore we chose to go into the trial at 800. This is the current design of the trial. The original protocol looked at 800 milligrams BID, and I'm going to be reporting on the CLL cohort. The study is designed with a futility boundary and Simon two-stage, and then if we don't see the futility, we go on to accrue a maximum of 40 subjects. The study had fully accrued the 40 subjects. We've also are looking at other B-cell malignancies and have recently added 2 cohorts, for idelalisib resistant and ibrutinib resistant subjects, and also exploring a new formulation with the study. The data cutoff for the presentation that I'm sharing with you is September 20th, 2013. The primary objective of the study was to evaluate the efficacy of 9973 in relapsed and refractory hematologic malignancies. And the secondary objectives are to evaluate the safety and tolerability of 9973, and also to evaluate the drug levels and pharmacodynamic measures. This was the data that I'm going to be presenting. The data cutoff, as mentioned, was September 30th of 2013. The safety data set consisted of all subjects who had received at least 28 days of drug, and the efficacy data set consisted of subjects who had received at least 56 days of drug, because the first evaluation occurs at week 8, week 16, and every 8 weeks thereafter. The CLL cohort at the time had 39 subjects. The predominantly were male. The median age is actually reflective of CLL, 73 years of age. They had a median of 2 prior therapies with a range of 1 to 6. 97.4% of them had prior anti-CD20 therapy, and the majority of subjects actually had previously failed an alkylating agent or a purine analog, and a small percentage of them had received anthracyclines. For the safety data set, it's similar in terms of male predominance. The age is similar. Obviously, because of the other diseases that are being treated, the drugs that they had been exposed to would be appropriate for those diseases. In terms of the disposition and exposure, of the 39 subjects at the time of this data cut, 32 were still receiving 9973. The exposure on median was 12 weeks. The reasons for discontinuation of study drug included adverse events in 3 subjects, related AEs in 2 subjects, and progressive disease in 4 subjects. This is the investigator-assessed nodal responses. As you can see, about 70% of the subjects had a measurable response, and this was seen across all the biological subsets, including very high-risk patients with 17p deletions or TP53 mutations, and also was seen in all the other biological groups. The patients that progressed are identified here by the stars, and they were also distributed in the different biological groups at that time. When we looked at the absolute lymphocyte responses, it's similar to what's been seen in other molecules. There was an initial rise in the absolute lymphocyte count that subsequently came down over time. And the change in the lymph node as the first evaluation and second evaluation showed a continued improvement. And this is the treatment of emergent adverse events for non-hematological. The grade 3 AEs were very uncommon in the safety data set of 78 subjects. We're actually up over 130 subjects right now in this study, and they remain similar. Fatigue was the most common grade 3, followed by nausea. And as you can see, the distribution of AEs were relatively well tolerated at the dose that was studied at 800. Similar to other agents that are targeted kinases, we did see a grade 3 and grade 4 elevations of ALT noted in the subjects. It again has occurred very early, around week 4, and resolved in most subjects with rechallenge. 2 subjects came off study for transient AST elevations. One withdrew consent, and one was accompanied with a grade 2 rash. And then this is looking at the ability to actually target SYK by pathway. This is at baseline, and then at day 8 and day 29 of the first cycle, we saw statistically significant decreases in p-SYK, p-BLyNK, and BTK in the subjects with CLL. And then this is looking at the chemokine cytokines following treatment with CLL. And again, at baseline, at day 8 and at day 29, we saw statistically significant decreases. So we're actually hitting the target and having the expected biological responses that we would for a SYK inhibitor. And the differences here were statistically significant. So in conclusion, 9973 is a highly selective SYK inhibitor. 9973 in this study, 102 was well tolerated in patients with hematological malignancies. There were reversible grade 3/4 transaminase elevations seen in about 12% of the subjects. We did not see any pneumonitis in this study in any of the subjects, including up with the extended data set of over 130 subjects. GS9973 has promising activity in CLL with a 69% nodal response rates. Consistent with other agents targeting BCR signaling, there is a transient peripheral lymphocytosis that is not dose limiting. Our current plans are to expand CLL following treatment with BCR targeted agents. We are also considering our registrational path forward with this molecule, and we will be presenting the full data at the ASCO meeting coming up.